Welcome to qnawire.
Hello students, in this question it is about diagnostic testing, and here we have been told that you're responsible for scheduling diagnostic procedures for patients in the neurology clinic at Fullwood Medical Center. Practice your knowledge of neurology by scheduling these patients appropriately using the following procedure. So patient needs and symptoms. First one is Dr. Solis would like to measure the speed at which patients' motor nerves conduct impulses. Second is the doctor has ordered a recording of the electrical activity. Electrical activity of the brain, patient's brain, and the doctor also suspects a tumor and needs to see highly detailed anatomical image of the brain. The patient needs x-rays of the spinal cord taken after dye has been injected to it. And lastly, Dr. Solis wants a sample of CSFs, and the patient has to schedule a study with contrast to image the cerebral blood vessels. So to measure the speed at which a patient's motor nerves conduct impulses, we will schedule the patient for a nerve conduction study. Secondly, to record the electrical activity of the patient's brain, and EEG would be used, that is electroencephalogram. Third, for a tumor identification, for the anatomical image, we need to schedule the patient for an MRI, that is magnetic resonance imaging scan. And fourth, for the patient who needs x-rays, the patient will be scheduled for a myelogram. And for the patient who has to take out or whose CSF is needed, we'll do a lumbar puncture, also called as spinal tapping. So lumbar puncture. And lastly, to image the cerebral blood vessels with contrast, we're going to schedule a cerebral angiogram. So these are your answers. I hope you found this video useful. Thank you.